Hi, I'm here today with you to explain the importance and our solutions for allergy protection. Did you know that every 3-4 minutes an anaphylaxis reaction takes someone to the emergency department? So the time I'm going to be talking with you, in that time, someone goes to the emergency department. I'm sure that many of you have heard or read about tragic news of someone, many often very young and not reaching the hospital, has died from anaphylaxis reaction. For instance, the story of Miriam, a 16-year-old who died after her boyfriend who had eaten just a peanut butter sandwich. But there are many other examples of that. But what is anaphylaxis? Anaphylaxis is a severe allergic reaction, rapid in onset, and potentially mortal. That it's triggered usually by allergens such as food, drugs, bee stings, and that can have many clinical presentations. It affects 1 to 5% of the global population. It's estimated that at least 1% of them may die. Even that is undiagnosed. The only effective treatment is epinephrine that is usually administered with an autoinjector like the one you can see in the picture. And patients at risk should always carry at least one of these autoinjectors. But these autoinjectors have many limitations, as we have seen in our clinical practice. To overcome these limitations, we have developed different products. The first solution is Anaphylaxis. It's a smart case that contains the autoinjectors linked via Bluetooth to an app in the smartphone that makes sure that the patient is always carrying with him or her the autoinjector, that the drug is in good working condition, and in the event of anaphylaxis triggers an emergency protocol that gives clear instructions on how to administer the drug and also sends to predefined contacts the exact location of that person that is having the anaphylaxis. Imagine that for parents of child and teens with anaphylaxis. It has many other features, but one of the most important also is facilitating the communication between patients and healthcare providers. Imagine that in our COVID-19 era that we're living now. This is very important. But what happens if the patient is not carrying the autoinjector when he or she has the anaphylaxis, or is the first time that they're experiencing anaphylaxis? For that, we have developed two other solutions that are thought for public spaces such as restaurants, and the aim of that is to bring the autoinjectors to the places where anaphylaxis can take place. We have the Allergo case. That is a container that contains and controls the autoinjectors that can be placed into an existing defibrillator cabinet, thus adding Allergo protection to a cardioprotective space. We also have the Allergo box, a standalone product that contains the autoinjectors, and makes sure that they're in good working condition, has a symptom checker, and in the event of anaphylaxis, starts also the emergency protocol, giving audio and video instructions, and sending the location to the emergency services. These three solutions are patented, and in the near future, they'll be able to provide also big data. But furthermore, the smart case for the individual patient has also demonstrated its utility, has been validated in a clinical trial, which has demonstrated significant improvement in the confidence, satisfaction with the autoinjector use. It has increased adherence, and it has decreased anxiety, and also it has decreased the number of anaphylaxis episodes. Imagine using these three in the individual patients with anaphylaxis and the public spaces. What we aim with these three solutions is to avoid deaths from anaphylaxis. We hope that you like our products and we want to collaborate, take part with us in getting Allergo protected. Thank you very much.